So it's started to share now, which is good. So you have the stage now, Miss Annette. It's all yours.
Oh, okay. Okay, like I said, I'm Annette van Ginkel, and I'm in Riyadh. And I'm actually enjoying it here, but I also need to say to you that I learned a lot, especially because of the millennials. So I'm here because of the millennials. Okay, we can go to the next slide. This is the hospital I'm working. This is at night, and it's actually a very young hospital. Next one. Can we have the next slide? Okay, this is the half of the team, and as you can see, it's very young people, and it's great people. And we are most are Filipinos. There's one Malaysian, 3 South Africans, and Egyptians, and Saudis, and 1 from India. And we are a great team. I must say, our team all support each other a lot, and that is what we're all about. Next one. Okay. Who is healthcare workers? So we always say doctors and nurses, but actually doctors and nurses are only a few of the people that is healthcare workers. What about the physiotherapist, the pharmacist, the speech therapist, and the respiratory therapist? And then there's a lot of other people that is actually part of our group. But the people who are the most in the back of us, and it's actually our force, it's housekeeping, because without housekeeping, we cannot do anything. Maintenance staff, waste removal staff, delivery staff, people that's working in the kitchen. Without them, we actually can't do what we do. You know, patients are happy with the medication we give them, but if they have a warm plate of food and they actually have a clean room, they're actually fairly happy. We try to do the best we can, but we are not the most important. Yes, we do the medication, we do the normal care, but the other people are just as important. And I must say, in the pandemic, these people actually shine, because without them, we can't do it. Next slide. There's a lot of studies. I must say, I was looking through a lot of things, and then they talk about mental health of healthcare workers in the COVID, the critical role of healthcare professionals during COVID-19 pandemic, and then they talk about a lot about mental health. And if you listen to the news and you see what's internationally, is that the frontline staff, the people working with COVID, actually has a lot of strain, has a lot of issues, because people are dying. Healthcare workers, if I look in my own country, healthcare workers are now at the forefront in patients that are dying, and that's complicated. Although, if I look at Saudi, yes, the cases are picking up a little bit more, but healthcare workers don't get so sick, because I must say Saudi does do a lot. They really do a lot in PPEs and in training and in support. I'm very happy to hear about Prince Sultan, what they actually do in their COVID project. They actually have a special place. Their staff are in a different building. They have internet and all those things, and that counts for staff. Not like where you work with COVID patients, and if you're not happy, you can go home. And a lot of staff, this is their big problem. Next slide. What is happening currently? Loss of income and compensation, because if you are sick, you don't get paid. If you a lot of places actually close down. People lose their jobs. People are more ill. People are more mentally ill, and with poverty, or with there's no food, you can't eat well. Your immunity are low. Loss of family and support. If I look at nursing, and especially expats that have single contracts, their family is far. Some people actually saw their family 2, 3 years lost. And how do you say to your 2-year-old, sorry, mommy can't visit? It's very, very hard on the staff, especially the younger ones. Limited family life. Yes, if your family are with you, you are so privileged and so blessed because you can actually hack your family member and say, oh, please just hack me. I need some support. What we also see is a lot of suicide in healthcare workers because suddenly they feel overwhelmed. They feel that they're scared. They're scared the whole time. Dying healthcare workers, work-life balance. We can't even go out. You're even too scared to go to the shops because who is there? And also, if you work with COVID patients, you also don't want to mingle a lot because of you're scared that you can give it to other people. Burnout and stress. Yeah. If you ever wear a hoodie and for 12 hours an N95 mask and then your yellow gown and a little head cover and shoes and all those things, you know what we're talking about. It's not easy on healthcare workers. And also relationships. People tend to be more, some people are depressed, some people are fighting, some people don't even want to talk to you because they are so overburdened. And if you look at cultures, some people won't talk. If you look at Filipino nurses, they will smile. You won't even know that there's something wrong with them. And we tend to forget that even if people smile, they might not be okay. Next one. I ask a lot of people, what makes you scared now? I just ask this question, what makes you scared? People saying, I'm scared that I'm dying. I also scared that my family member are dying. Never see my family, losing my job. I've got losing my job somewhere twice. Suicide. There is people that say, you know what, I don't even want to live in this time because I am more scared than something else. And there is no life for me. And some people are lonely. And that is the biggest thing, is loneliness. We are human beings. We are social human beings. If we say our patients are social, physical, emotional, spiritual, we are also like that. It's not just our patients. Next slide. Mental issues of healthcare workers, a lot of them are depressed. And you know, mental issues is actually a problem because there's always a stigma. There's a stigma. But if you think that you're having mental issues, what about your family? Sometimes your family will say, please don't hack me. Please don't come with your uniform at home because we're scared that you're going to give us COVID. And also, we're scared also that we're going to give them COVID. We're anxious because you're working day after day with COVID patients. You see patients complicating in front of your eyes. Yeah, not everyone die, not everyone complicates, but a lot of them do. And what do? You're anxious because what if I do something, or what if I can't save my patient? Some people withdraw, that's just a coping mechanism. Some people fight and they're in conflict because inside them they have a lot of conflict. Sense of isolation because now you must wear a mask. You cannot go anywhere. There's lockdown here, lockdown there. You can't go to your family because the airports are closed. And there's nothing you can do about it. Feeling of despair. I'm just tired. I don't know what to do. I don't have any answers. I will just leave it. And nurses and also other like doctors, we always want to help people. It's so nice if your patient gets better. And when you are like that, you might have a situation where you don't have empathy. Nobody looks after me. Why must I look after somebody else's mental illness or issues or their health? Because nobody looks after me. I'm not okay. And we can't verbalize, because if you're not okay, then you are weak. It's not a sign of weakness if you say, I'm not okay. Next one. Physical issues, increased sick leave. What I saw is that people will go and say, I've got flu, I've got a sore throat, I've got a headache, I can't smell. Because after you did your swab, you can have 2 days off. And that is a reality because they are burnt out. Weight gain because you don't have time to eat. So, and you also don't sleep well. So what you can get, you will eat. And it's not always healthy food. Or you don't eat, loss of weight. You don't have time to cook. You don't have time to eat. Hypertension, increase of use of habit-forming substances. And also you have body aches. You have pains where you'd never know that there is a place. You have pains. And what are you going to do with that pain? You take anti-inflammatory, it's not working, you're taking something else. Maybe you have a headache and all what you actually need is water. But there's no time to drink water. You just need to go on. And if you go on like you're depressed, you don't eat well, you don't do exercise, you don't have energy, you can't cope anymore. There's no energy anymore. Another one? Sorry. What can leaders do? If you watch Amsterdam, New Amsterdam, what's very, very remarkable, that doctor, the CEO of the hospital, always say, what can I do for you? Do the leaders ever go to the unit and just go around? Don't go look for dust. Don't go look for clutter. Don't look for any faults. Just go there and ask the staff, how are you? Are you okay? What can I do for you? We don't want food. We don't want extra things. All what we want to see people that they really care about you. So the support they need, the staff needs it. Wellness programs. There's a lot of literature about wellness programs. But what I found is that if there was a wellness program, it actually is not functioning anymore because everybody focused only on COVID, on PPEs, on swabs, on vaccinations. But there is not a wellness programs actually running at the moment. Wellness events, wellness rounds. If the leaders go and do a round and just say thank you to the staff and not say to them, if you don't like it, go home. Because this is not what they want to hear. They want to work, but they're exhausted. There's services. What you can have is like counseling services. Is there resources for them where they can phone and say, I don't cope, please just help me? Recognition. A lot of our staff, they enjoy recognition. Just a thank you, that is fine. Incentives. Yes, other hospitals will say, oh, but we got COVID money. And people really say, oh, we're going to get COVID money. So it just keeps them alive or supported. But then the COVID money is not arriving. So they say, oh, then I'm not going to work. I'm not going to work so hard. Time off. When they spoke to us like Prince Sultan Hospital, what's very important, what was very interesting is that the people work 8 hours and they 24 hours off. I must say, wow, because that is really great. Imagine you are off for 24 hours and you only work 8 hours. You can rest, you can eat, and you actually feel people are actually caring. Vaccination campaigns, this I must say, Saudi is very good in that. We did get it, and it's just you that need to register and you need to get it. And it does give you a little bit of okay, people are looking after me. Take care of your staff. So leaders must take care of their staff. That is most important. Environment of open communication. Open communication is very, very important, that I can say, sorry, I can't go. Please just sit here by my patient while I'm doing something else, or I just go and eat, or I just go and breathe somewhere. I think this is important, and that it would be very interesting to go to Prince Sultan and actually see what they're doing. It will be, for me, it will be wonderful. Another slide. What can I do? Meditation. You know, if I am overwhelmed, I just breathe. Even if my eyes are open, I breathe, but I want to hear my breathing. I just focus on my breathing because sometimes it happens in the unit. You ventilate people, everybody's running, you're trying to get PPEs, you're trying to get medication, and then something is not working. And sometimes you just need to stand a little bit behind and say, just 2 seconds, just give me a chance just to get my breath. Group debriefing sessions. I think we don't debrief. We don't put a lot of emphasis in debriefing. Just to say, how did you feel? Already you feel that somebody is, thinking that you are important. In our unit, I'm working in, we've got our chairman is a doctor. And why? He is so good. You know, he will ask us, how do you feel? What can we do better? I think we need to do training in this. We can do it. And if somebody just debrief, we feel that somebody listened. Social gatherings in small groups. We do know that we're not allowed to go in big groups. So small groups, it's fine. Just let us have a meal together. Let us have coffee together. At least we can talk. Healthy eating? Yeah, you can do that. But I feel that that is one of the things that we don't do. Rest and sleep. Some people sleep too much. Other people don't sleep. And sometimes you wake up at night. And what are you doing first? You're on your Facebook. And this is the thing, sometimes you just need to close your Facebook. Exercise. Yeah, we don't do it. The gyms are closed. And also, you don't have the facilities where you stay to exercise. I also want to say that it's important to say today, I don't feel well. Please, I'm not angry. I just don't feel well. So people can know that you are a little bit vulnerable today. Intentionally employ coping strategies. Everybody is different. If you look at the different type of personalities, some people want you to talk to them the whole time. Other people want facts. Other people want lists. Other people say, just don't talk to me. I'm okay. I'm fine. They're okay. What I found is reflect about things. It's important because I can say, okay, this happened today. How can I make it better? What did I do wrong? And what I learned to do is to go back to a person. Say I shouted at somebody. To go back and say, you know what? Actually, I was wrong. Let us just see what we can do from now on. Take breaks from social media and news and negative people. How many times did we hear people, COVID is not, it's the government who's actually want to control us. I am not going to do the vaccination because they're going to put chips in us and they will know where we are. Of course I know where we are because we are on all types of apps. Does it really bother me if anybody knows where I am? But put your phone off, put it on silent, not only on vibration, because if it vibrates, then you wake up and then you tend to be nosy and you want to know what's happening. And also remember your goals. Why are you where you are? I am here to work towards my goals, but other person's goals are different. So, and let them achieve their goals. Yes, we are all anxious. We are all scared. But remember your goals while you are here, while you are having a tough time. Next slide. Lastly, if healthcare staff are content and feel supported, they will be able to deliver safe patient care. And that is what we want to do. That is also staff. If you look at the next slide, we always want a party. This is, we have faces, we always want to eat, and we are laughing. And this is important. This is putting us together. If we have goals, if we have things to do, we do it together. And if your staff is smiling, they're happy, they feel content, they will do much more for your patients to be happy and safe and also content. But if you don't feel well, you feel overwhelmed, you feel depressed, you feel tired, you're not going to do more. I think that the workplace can do much more for their staff. But I think also staff needs to tell what you need, and everybody needs something different from the next person. And if you see healthcare workers, they eat. Thank you. You can ask questions if you want to.
Well, thank you very much for sharing that, Miss Annette. That was a good presentation. It really brought home what's happening around the world at the moment and how it's having an impact on healthcare professionals and in the healthcare settings. And it also brought to light that unity is so important, you know, under these circumstances. Working together and being on the same page to promote recovery and well-being of oneself and our colleagues.
Yeah, you know what I want to say is that I am more mature than a lot of the younger ones. So they on their phones the whole time. So you come and say, why are you on your phone? Hello? Why not? Because I realize if you're on your phone and you play a game, actually you relax. I never could understand it because my child is their age. Now I come there and just find fault. And what I also realized, I needed to change. Not them, I need to change. And I need to say, I embrace your youngness. I embrace everything that you are about. Teach me also certain things. And if you change, everybody around you change. And don't always shout. Don't always see what other people is also going through. Before you say, you're useless, you don't know what you're doing, don't do it. Because all of us are stressed.
You never know what anyone else is going through, do you, really, until you speak to people and try and get to know them a bit more and support them the best way possible.
Yeah.
But also, I think it's important to reflect on one's actions as well, you know, just to try and find what went right, what went wrong, how can we make this better?
Yes. This is new for everybody, isn't it? It's new for everybody. Everybody went into a thing and we don't know what we're actually going through. We don't know what hit us. And we are social. We want to party. We want to go out. We want to shop. We want to eat. Now we can't.
Yes, exactly. I totally agree. Has anyone got any questions? Okay.
Thank you.
Well, if there is any other questions, just put them on the chat box. And Miss Annette, thanks again for a great presentation.
Thanks.